Okay, now let's proceed to case number 2. So, ABO typing was ordered for a 12-year-old boy diagnosed with E. coli infection with the following results. Now, let's analyze the results. So, in forward typing, it has a strong reaction with your anti-A or 4 plus, which means that your A antigen is present. Then we also have a weak mixed field reaction with your anti-B or a 1 plus mixed field. So small or abnormal B reaction. So forward typing suggests probably the patient is a group A individual, but something unusual is happening with the anti-B. Reverse typing, it has no reaction with your A1 cells. So there's no anti-A, and this is correct for your group A individuals. And then it has a strong reaction with your known B cells 4 plus. So the anti-B is present. This is also correct for your group A individuals. So reverse typing clearly says that our patient is a group A individual. So for the RH typing, the anti-D is positive 4 plus. So the patient is RH positive. So what's the discrepancy? So in forward typing, it shows strong anti-A, but it has a weak mixed field anti-B reaction. So the reverse typing clearly shows that he, the 12-year-old boy, is a group A individual. So the problem here is the unexpected weak reaction with your anti-B in the forward typing. So what's the clue? The patient here is a 12-year-old boy with E. coli infection. Again, from our discussion earlier, so there are certain bacterial infections, especially gram-negative bacteria like E. coli, can cause the acquired B phenomenon or the acquired B antigen. So what is acquired B phenomenon? Normally, group A red cells have A antigen only, but in some bacterial infections, bacterial enzymes modify the A antigen slightly. The modified A antigen looks like the B antigen, so the anti-B reagent reacts weakly. So this causes weak or mixed field anti-B reaction in the forward typing. So but reverse typing remains normal because the person is not truly group B. So this is a group 2 ABO discrepancy involving weak or missing antigens. So the problem is in the forward typing. So how are we going to resolve it to confirm acquired B phenomenon? So you can wash red cells thoroughly, which will remove the bacterial enzymes. You can test it with acidified anti-B reagent in which the true B antigen reacts and the acquired B does not. So test patient serum with known A1 cells. It should remain 0 or negative. You can review the clinical history. Infection is present. After the infection resolves, so the anti-B reaction disappears. So which result is correct? The reverse typing is correct. Forward anti-A 4 plus is also correct. And then the weak anti-B is false, and it is caused by an infection. So what is the correct blood type of our patient now? It's ARH positive. Now let's proceed to case 3. A 30-year-old man needed 2 PRBCs for transfusion, so the following is the result of his pre-transfusion testing. So the antibody screen was positive, then the antibody identification panel revealed anti-M in the serum. Let's analyze the results. So in forward typing, this means that the patient's red cells have both A and B antigens since it has a strong reaction, 4 plus. So the forward typing, it says group AB is the blood type of our patient. In the reverse typing, now if the patient is truly group AB, the plasma should have no anti-A and it should have no anti-B. Therefore, it should show 0 reaction with known A1 and B cells. But in here, we see that the A1 cells is 1 plus, which is weak positive, and the B cells is 0. So this means there is an unexpected antibody reacting with your A1 cells. The RH typing, the anti-D is 4 plus, so the patient is RH positive. So what's the most important clue in this case? So it states that the antibody screen was positive, and then the antibody identification panel revealed anti-M in the serum. So this is very important. So what's the discrepancy? In the forward typing, the patient is blood type AB, while in the reverse typing, it should be expected to have a 0 reaction with known A1 and B cells. But in here, we see a weak reaction or a 1 plus with A1 cells. This is not anti-A. This is most likely anti-M reacting with M antigen present on A1 reagent cells. So this is a group 4 ABO discrepancy because there is a presence of an unexpected antibody. So what is anti-M? Anti-M is an antibody against the M antigen, which is found in the MNSS blood group system. It is usually IgM in nature. It reacts at room temperature. It is commonly detected during antibody screening. If the reagent A1 cells used in the reverse typing are M positive, anti-M in the patient's serum will react with them. So this causes a false positive reaction in the reverse typing. So why does it not react with the B cells? Because the B reagent cells likely do not have the M antigen. So anti-M has nothing to react with. That's why known A1 cells is 1 plus, and then the known B cells have 0 reaction. How are we going to resolve this? So to confirm, you can test reverse typing using M negative A1 cells. You can perform reverse typing at 37 degrees Celsius because anti-M often weakens at body temperature. You can also use pre-warming techniques. When you are going to use M negative cells, the reaction with your A1 cells should disappear. So which result is correct? The forward typing is correct because there we can see that it has a strong 4 plus reactions with anti-A and anti-B. So clearly the patient is blood type AB. So the reverse typing discrepancy is caused by an unexpected antibody, which is the anti-M. So what's the correct blood type now? So our patient is blood type AB Rh positive.